case for take-home naloxone is quite clear. The evidence is out there. It's been out there since about 1961. Naloxone has been out on the table. So what we're kind of saying here is why isn't it out in the hands of the people who need it? Now, what I need to say to you is the information that you're going to pick up on naloxone today. If you don't want to pick up this naloxone, this information, and take it out into the community, then you need to put your headphones in. Because if you get this information and you don't take it out into the community, you're part of the problem, not part of the solution. And you're focusing on what we're kind of focusing on, trying to break down the negligence. Negligence in tort law is if I've got something that I know can increase somebody's health and well-being, and I choose not to use it, then I'm negligent. Here's the evidence for the take-home naloxone programme. Right, England is the only place that hasn't got a national programme. You want to know why? Right? In Scotland, the evidence is up there quite clear. In 2013, they had a 7% drop in fatalities. In Wales, there's been a programme about since 2011, and they've had a 50% drop. And then we have England. I'll let you read that for yourself. We've had a 32% rise because we have no national programme. The evidence is there. We need a national programme. Alright? 765 people out of your community that are no longer here. That's quite a high number, isn't it? Now, I don't know about you, but if you throw statistics at me, they go over my head. Right? So what I'm going to ask is, see this section here? Can you all stand up? That's how many people we lose in a month. In 1 month in our community. Now, I don't know about you, but I don't think that's acceptable. Because that's 1 month. You can sit down again now. Thank you. That's in 1 month. Yeah. Now, 2013, 765 people. That's 765 souls that we've lost. 765 broken families. 765 mothers, fathers, sons, daughters. 765 human beings that we failed because we haven't got a national programme. It's quite high, isn't it? I think it's disgraceful. If it was for any other life-threatening illness, there would have been a public outcry. Over half of the number that we've lost. A quarter of the number we've lost. So why are we not getting the same attention? Why are we not getting the same drive? If it was for cancer, it would have been out there by now. So why are we fighting? Is it because of who we are and what we are? Yeah? So why? Why are we any different? I'm a human being. Will it bring them into services? Of course it will. Of course it will. A lot of the people I've talked to about naloxone have said it was a turning point in their life that made them access services. It gets us out into the hard-to-reach community. We get to speak to the hard-to-reach community. When we're out there campaigning for it, we're out there advocating for it. We talk to people that services might not actually be aware of out there or can't get into them. As a using community member, you're out there and you manage to get into places, into the hotspots where a service provider wouldn't get into. And if you're carrying a message that this is available in the service, you're going to bring people and get bums on seats. Simple. If somebody overdoses, it's going to scare the living shit out of them like it did me. So you're going to look for second support, aren't you? You're not going to think, oh, it's alright, naloxone brought me around and I've got another kit. So I don't need your services. You're going to have to go into the service to get another kit. Yeah? So it's an open window. If people are going into need exchanges and they're getting a little bit of training, getting a kit, excellent. In the words of recovery, one is too many, but the government seems to think 1,000's not enough. So Public Health England, we want them to commission services, and we want naloxone, take-home naloxone as part of the commissioning. We want that as a requirement, not a recommendation, a requirement. Because we don't want our people dying anymore. I know I don't. I've lost a lot of friends. How you can help us? Now, my opinion on this is you guys are out on the front line. You guys are out there every day doing what you do, whatever kind of camp you sit in. You're out there doing what you do. You're out there seeing the effects of overdose every day. You're out there seeing the effects it has on families. You're out there listening to people who are saying, yeah, I lost my son last week, I lost my son last month, my mum died last month. It's cold to hear. And we want to give you something and you can go out to them and say, you know what, stand with us. You may have had a loss, but can you help us to stop other families from going through the same? We've got a number of family members and mothers against drugs and all that kind of stuff that are standing up and advocating for this. It's a global campaign. It's not just local, it's a global campaign. So we want you to go out into your areas and start up naloxone action groups. Now, demand naloxone in your area. Don't pussyfoot around and say, can we have it? Demand it. It's your community that's dying. Your community, not the people that hold the purse strings. It's your community members, so get out there and demand it. And nag. So this is what we want you to do. We want you to carry the message back to your respective areas and join us. And we want to turn the whole of England upside down shouting for naloxone. Because I don't want any more of our community members dying. There's no need. Every death is preventable. Now I'm not saying it's a magic cure, and I'm not saying it's a magic wand, and then we might have been able to save everyone. But who's to say who we could have saved and who we wouldn't have saved? And who's to say that we could have saved everyone? The fact is we could have saved at least half of them. At least. Since this programme 2019, over 10,000 lives have been saved.
One of the reasons that we were able to achieve change around naloxone globally was because active drug users and recovery drug users work together because we both have a shared agenda around naloxone. So please come to the meeting at 1:15 in the reset area, in the exhibition area, so that we can show how ex and current drug users can work together.
So this has just been published, and it's a nudge to local authorities and commissioners to ensure that they make naloxone as readily available as they possibly can ahead of the changes to legislation that come in October. So basically it's don't hang about and be stingy with this. Do whatever you can to make sure it gets into the hands of people who are likely to help avoid an unnecessary death. So this is good news. So it's really good to be able to follow Kevin and say we have been listening. We have done this as fast as the processes can allow, and this is the first step. Obviously October will be the second step, and then there's no excuse. And I did just ask Judith in the coffee break where I can get one of those t-shirts, because I want one of those Keep Calm and Carry Naloxone t-shirts as well.